Imagine being 32 years old. You wake up one morning and something feels off. Your head hurts, your body aches, you feel unusually tired, and your first thought is probably, I must be coming down with something. Maybe a cold, maybe a mild flu. You take some ibuprofen, drink some tea, and tell yourself you will feel better in a couple of days. But what if the thing you are dismissing as a common cold is actually something your body is trying to warn you about much more urgently? Right now, as of May 2026, hantavirus is in the news in a way that it has not been in years. A deadly outbreak of hantavirus among passengers aboard a cruise ship in the Atlantic Ocean was reported to the World Health Organization on May 2, 2026. 3 people have died. At least 8 people on the ship are confirmed or suspected cases. And health officials from multiple countries have evacuated passengers and are monitoring them in quarantine. And here's the thing that makes this virus so particularly dangerous and why this video matters right now. Early symptoms of hantavirus including fever, headache, muscle aches, nausea and fatigue are easily confused with influenza or a common cold, which means that every year, people look at their own symptoms and think, this is just a bug going around, I will ride it out. And for the vast majority of people with a cold, that is exactly right. But for someone who has been exposed to hantavirus, that wait-and-see approach can be fatal. So today we are going to break this down completely. What hantavirus actually is, how it spreads, what makes its symptoms so deceptively similar to a cold in the beginning, and then the critical part, how you actually tell them apart, stage by stage, so you know exactly when something ordinary becomes something that requires immediate medical attention. Let's start with what hantavirus is, because most people have only a vague sense of it. Hantaviruses are zoonotic viruses, meaning they naturally infect animals and are occasionally transmitted to humans. They are carried by rodents, and in the Americas they can cause hantavirus cardiopulmonary syndrome, a rapidly progressive condition affecting the lungs and heart. In Europe and Asia, different strains cause hemorrhagic fever with renal syndrome, which primarily affects the kidneys and blood vessels. Hantavirus infections are associated with a case fatality rate of up to 50% in the Americas. Let that land for a moment. This is not a virus where you feel terrible for a week and bounce back. This is a virus with a mortality rate that rivals some of the most feared diseases in medical history, and it begins every single time looking like something you have had dozens of times before. Now, how does someone actually get it? People get hantavirus from contact with rodents, especially their urine, droppings, and saliva. The most common route of infection is inhaling air that contains dried particles of rodent waste, what scientists call aerosolized material. This most often happens in specific situations: cleaning out a garage, barn, shed, or cabin that has not been used in a long time, going through storage areas, camping, farming, hiking in rural areas where deer mice are present. You do not have to see a mouse, touch a mouse, or even know a mouse was there. If its dried droppings were disturbed and you breathed in that air, that is a potential exposure. The Andes strain, the strain responsible for the current 2026 cruise ship outbreak, is the only known strain of hantavirus documented to spread from person to person, and even then, only through close and prolonged contact. The most common strain in the United States, called Cinnamovirus, does not spread person to person. Now let's get into the comparison that is the core of this video, because this is where real life-saving awareness lives. The common cold, you know it. Everyone does. You wake up with a scratchy throat, maybe a runny nose, perhaps a mild headache. You feel a bit run down. Your temperature might tick up slightly, maybe 99, maybe 100 degrees, or you might not have a fever at all. Your nose starts running. You might sneeze. Your throat gets sore. The hallmarks are nasal congestion, a runny nose, a mild sore throat, and a gradual buildup of symptoms over the first day or two. Importantly, the discomfort with the cold is concentrated in the upper respiratory tract, your nose, your throat, the sinuses behind your forehead and cheeks. Now here is hantavirus in its early stage. And pay close attention, because this is where the similarity is real and the danger is real. Early hantavirus symptoms typically appear 1 to 8 weeks after exposure and closely mimic the flu. Common early signs include fever, fatigue, chills, and deep muscle aches, particularly in the thighs, hips, lower back, and shoulders. Headache, dizziness, nausea, persistent vomiting, diarrhea, and abdominal pain may also appear during this phase. Now notice what is missing from that list. There is no runny nose, no sore throat, no nasal congestion, no sneezing. These are the symptoms that define the common cold, and they are almost never present in hantavirus. The CDC notes that hantavirus early symptoms are more easily confused with influenza than with a cold. But even compared to flu, there is a distinguishing feature that experts point to repeatedly. Doctors describe a very distinct feature of hantavirus: severe leg, hip, and back pain that does not respond to ibuprofen or Tylenol. Every person infected with hantavirus will experience this deep muscle pain, even if they do not develop other symptoms. That detail is important. If your body aches are the deep, grinding kind in large muscle groups, thighs, hips, lower back, and the over-the-counter pain relief is not touching it, that is a biological signal worth taking seriously. A cold might make you feel generally achy and tired, but the severity and location of the muscle pain in hantavirus is categorically different. Let's also look at the fever. With a common cold, fever is either absent or very mild, usually under 101 degrees Fahrenheit. With hantavirus, fever is present in 93% of confirmed cases, and it typically presents with chills and the sudden pronounced onset that feels less like coming down with something and more like a switch being flipped. The gastrointestinal symptoms are another differentiator. With a cold, nausea, vomiting, and diarrhea are not typical features. In confirmed hantavirus cases, nausea and vomiting appear in approximately 44% of patients, along with significant abdominal pain and diarrhea. If you have what seems like a cold but you are also dealing with significant stomach upset, that combination should prompt you to think beyond the common cold. Now we come to the stage that makes hantavirus a true medical emergency, and this transition can happen with frightening speed. Hantavirus pulmonary syndrome advances through two distinct stages. The first stage can last several days, with fever, chills, and muscle pain. Then, as the disease progresses, it leads to damaged lung tissue, fluid buildup in the lungs, and serious problems with both lung and heart function. Symptoms can worsen suddenly and become life-threatening. The second phase of the virus presents itself 4 to 10 days after the initial onset of symptoms. At this point, symptoms progress rapidly as the lungs begin to fill with fluid, and new symptoms include a cough, rapid heartbeat, shortness of breath, and chest tightness. This pulmonary phase can progress to severe respiratory failure within 24 to 48 hours. The CDC reports a case fatality rate of approximately 38% for hantavirus pulmonary syndrome in the United States. 38%, more than 1 in 3 people who reach the respiratory phase in the United States do not survive. This is why the early recognition window before the lungs are involved is so critically important. A common cold will never do this. A cold does not fill your lungs with fluid. A cold does not crash your blood pressure. A cold does not send you into respiratory failure within 2 days of developing a cough. If you are in that early phase and you dismiss it, and then the cough comes, and then the shortness of breath arrives at that point, you are in a race with time that is extremely difficult to win. The virus can progress quickly, causing inflammation in the heart and lungs, which may result in fluid buildup and eventually death. In the current 2026 cruise ship outbreak, one person who died presented first with fever, headache, and mild diarrhea. He developed respiratory distress a week later and died the same day that distress appeared. 1 day, from first showing respiratory symptoms to death in 1 day. That is the velocity of this disease when it is not caught early. So let me give you a very clear decision framework, because this is the practical part that matters most. If you have a runny nose, nasal congestion, a sore throat, and mild fatigue with no significant fever and no muscle pain, that is the profile of a common cold. Rest, hydrate, and monitor. If you have a high fever that came on suddenly, deep muscle pain particularly in the thighs, hips, and lower back that does not respond to pain relievers, significant fatigue, and possibly nausea, vomiting, or diarrhea, and you have had any potential rodent exposure in the past 1 to 8 weeks, or you have been in close contact with someone who has hantavirus, those are red flags that require a medical evaluation, not a home remedy. If you develop shortness of breath, rapid or labored breathing, chest tightness, severe dizziness, confusion, or signs of low blood pressure, call emergency services immediately. Do not wait. Do not drive yourself. This is the moment where every minute matters. When you see a doctor, tell them about your potential rodent exposure, because early hantavirus can so closely resemble common infections. The exposure history is often what distinguishes it and prompts the right testing. The virus is difficult to diagnose in the first 72 hours even with testing. So if initial tests come back negative but symptoms continue and worsen, repeat testing is essential. Now let's talk about how you reduce the risk in the first place, because prevention here is entirely achievable. If you need to open and clean a building, garage, cabin, or storage space that has not been used in a long time, air it out for at least 30 minutes before you go in. Wear an N95 respirator, not just a cloth mask. Wet down potentially contaminated surfaces with a disinfectant before you clean, rather than sweeping or vacuuming, which can throw particles into the air. Block rodent access to your home by sealing holes with wire screening, steel wool, or cement. Store food in rodent-proof containers. Clear brush and debris from around your foundation. Keep wood piles away from the house. These are not complicated measures. They are the difference between exposure and no exposure. Here is the broader picture I want to leave you with. Most people who are reading about hantavirus right now will never get it. Since surveillance began in 1993 through the end of 2023, there have been 890 laboratory-confirmed cases of hantavirus disease in the United States. It is genuinely rare. The CDC has categorized the current cruise ship outbreak as the lowest level of emergency for the general American public. The overall risk right now is low, but low risk is not zero risk. And the reason this virus is worth understanding is not to panic. It is because the window between this feels like a cold and this person is in respiratory failure is measured in days. The knowledge you have right now about what makes hantavirus different from a cold, the location and severity of muscle pain, the absence of nasal symptoms, the gastrointestinal involvement, the specific exposure history, and above all the appearance of any breathing difficulty, that knowledge is what keeps a low-risk situation from becoming a tragedy. Your ability to tell the difference is not just information, it is protection. Take it seriously. Share this with people you care about who spend time in rural areas, who camp, who farm, who are going through old storage spaces this season. Because the people who are most at risk are almost always the people who least expect it. If this video gave you clarity on something that genuinely matters, please share it and subscribe to Wellness Over Time. This is the kind of content we are here to create.